This is Plant-Based Briefing, Women's Brain Health, a Dark Past but a Bright Future, by Dean Sherzai, MD, at braindocs.com, and I'm your host, Marian Erickson. This is the curated content plant-based podcast where I narrate articles on healthy, compassionate, and sustainable living with permission in about 10 minutes or less every weekday, and I'm pleased to have permission from the braindocs to share their content. The braindocs are Drs. Ayesha and Dean Sherzai. They're both practicing neurologists, scientists, authors, parents, and husband and wife duo that know the value of healthy lifestyle choices. They met as young physicians, and in their first conversation, they learned that both of their grandparents had spent their remaining days on Earth suffering from dementia, and they vowed to do whatever they could to help others avoid this fate and build healthy minds and bodies. They conduct research, treat patients, and serve as professors at Georgetown University, Columbia University, the National Institutes of Health, Mount Sinai, and Loma Linda University, where they serve as co-directors of the Alzheimer's Prevention Program. They've worked with devastatingly disease-ridden populations and some of the healthiest people in the world, the Loma Linda Seventh-day Adventist population, which is a blue zone community, defined by living measurably longer and healthier lives due to optimal nutrition, exercise, stress management, and social support. They have a best-selling book called The 30-Day Alzheimer's Solution, the Definitive Food and Lifestyle Guide to Preventing Cognitive Decline, and it's got amazing plant-based recipes and information on what to eat and what not to eat. They also have a fantastic podcast I recommend called Your Brain On, so check that out as well. And now let's get to today's plant-based briefing. Women's Brain Health, a Dark Past but a Bright Future, by Dean Sherzai, MD, at braindocs.com. For centuries, the narrative surrounding women's brain health has been overshadowed by pervasive biases and misconceptions. Women have often been deemed less intelligent, with supposedly inherent limitations in brain anatomy and capacity. This skewed perception was deeply entrenched in the medical field, affecting research, diagnosis, and treatment of women's health conditions. These biases highlight an urgent need for a reformed approach that acknowledges and addresses women's unique health challenges, both neurological and otherwise. Historical bias and misdiagnosis in women's health. Biases in women's brain health have been notably influenced by prominent figures like Sigmund Freud, who asserted that women were more prone to hysteria due to their biological and emotional states. This contributed significantly to gender disparities in healthcare. Similarly, Jean-Martin Charcot's studies on hysteria and Paul Broca's ideas about the implications of brain size have perpetrated notions of female fragility and intellectual inferiority, leading to widespread undertreatment and minimal research into conditions uniquely affecting women. Dr. Lise Elliott, professor of neuroscience at the Chicago Medical School at Rosalind Franklin University of Medicine and Science, addressed the size difference between women's and men's brains on our podcast Your Brain On, Being a Woman, saying there's one unequivocal difference, an unambiguous difference, which is men have larger brains than women. It's about an 11% difference, at least in the North American and European populations that have been most studied. Brain size varies with body size, and of course, men have bigger bodies than women. They are 9% taller and 18% heavier on average. Bigger bodies need bigger brains. Working toward equality in healthcare. The predominance of male physicians has sometimes resulted in a communication style with women patients that may not fully acknowledge their concerns or experiences, inadvertently fostering an environment where misdiagnosis and undertreatment are more likely to occur. This scenario, not necessarily born of ill intent, but perhaps from unchallenged medical traditions, has widened the gap in healthcare quality between sexes. The history of healthcare for women is marked by practices that cast long shadows over the legacy of medicine. The use of lobotomies stands out as a particularly egregious example, a procedure once heralded as a breakthrough, but now viewed with horror. Applied far more frequently to women, lobotomies were often prescribed to manage behaviors considered unruly or inconvenient, without true consideration for the individual's well-being or consent. In our podcast, Your Brain On, Lobotomies, we shared the story of Rosemary Kennedy, sister of President John F. Kennedy, whose father decided she should undergo a prefrontal lobotomy when she was 23, physically cutting connections in her brain in an attempt to treat what her family deemed erratic behavior. And in the episode Your Brain On, Being a Woman, we highlighted other historic women whose conditions were given dismissive diagnoses, like renowned Mexican artist Frida Kahlo and iconic American writer Virginia Woolf. This dark chapter is a stark reminder of past abuses and a call to action for the medical community to continue reshaping healthcare systems in a way that respects all patients' autonomy and rights, ensuring that such violations of trust and compassion are never repeated. When we understand and acknowledge these mistakes, the path forward promises commitment to ethical standards and empathy in patient care, where the dignity of every individual is upheld. To quote Ayesha from our Being a Woman episode, when Rosemary Kennedy's life was destroyed by her lobotomy, the doctor who led the procedure went on to perform thousands more. Most of his lobotomies were conducted on women. Research gaps and the foreseeable future of women's health care. In spite of recent progress, the oversight in women's health research remains a prevalent issue, impacting how female-specific health concerns are understood and addressed. This gap is particularly evident in areas like menopause research, which has significant implications for women's overall health and well-being. Neuroscientist and educator Dr. Lisa Mosconi, whose book The Menopause Brain was published in March 2024, joined us on Your Brain on Alzheimer's, saying, "There's evidence, especially as related to Alzheimer's disease, longer estrogen exposure throughout a woman's life is protective, which is a very important thing to consider because so many women go through menopause for surgical reasons and they just do not receive counseling around brain health or Alzheimer's prevention." Recognition of these research deficits has sparked a movement towards more inclusive and comprehensive health studies. Initiatives focusing on the female brain, the effects of hormonal changes on mental health, and other sex-specific challenges are gaining traction. Dr. Mosconi continued, "It's going mainstream. Maria Shriver is talking about menopause. Halle Berry is talking about menopause. There's so much more empowerment. I think that our generation of women are just done being patronized and being put down and just being patted on the head. They want solutions, and they want the research." Empowering women's brain health requires a multifaceted approach that addresses long-standing biases and embraces gender-sensitive healthcare practices. This effort must be championed by the medical community, researchers, and policymakers alike, all of whom play a crucial role in reshaping how women's health issues are approached and treated. Dr. Margaret McCarthy, renowned for her research into the neuroscience of sex differences, said this on Your Brain on Being a Woman, "This is where the difference in the hormonal milieu of a 60-year-old woman and a 60-year-old man could be so profoundly important because he has lots of testosterone. It might not be what it was when he was 20, but there's still a lot, whereas she, by and large, has very little steroid hormone. And we could do better at understanding that. What are the good parts about having a hormone replacement therapy, and what are the actual risks? There's a real urgent need for a lot more research in that area." The push for equity in women's brain health, while challenging, is an essential endeavor to ensure that all women receive the comprehensive and empathetic health care they need. The story of women's brain health up until now is a testament to resilience in the face of systemic bias and neglect. As society progresses, the focus must shift to understanding, researching, and addressing the unique health challenges faced by women. Only through dedicated and intentional efforts can we hope to close the gaps in women's health care and ensure a future where women's health is no longer an afterthought, but a priority. The time to act is now. The health of our mothers, sisters, and daughters depends on it. You just listened to Women's Brain Health, A Dark Past, But a Bright Future by Dean Sherzai, MD at thebraindocs.com. And I'm your host, Marian Erickson. And for some related episodes, I'll link these in the show notes, but you might want to check out 854 and 855, Hormone Replacement Therapy and the Opioid Epidemic, When Standard Therapies Become Dangerous, and some others about women's health in general. 309, Fighting Hot Flashes with Diet. 401, Myth-Busting Soy, Women's Health and Hormones. 474, Dietary Approach to Naturally Treating Menopause Symptoms. 620, Fitness Over 50, 7 Ways a Plant-Based Diet Can Help Women Stay Active. 687, Soy Foods for Menopause Hot Flash Symptoms. 711, The Plant-Powered Path Through Perimenopause. And 935, Can Plant-Based Foods Help with Fibroids? So please share this episode with anyone who might benefit, and thanks for listening.